Hey there. Think about a time recently when you woke up with a really bad headache. Now, do you remember what you told yourself about that headache? Did you think, maybe I'm coming down with a cold? Maybe this is a sinus infection coming on? Maybe even too much to drink last night? Or did you tell yourself, I think this might be a brain tumor? Which, by the way, waking up with a headache in the morning is a sign of a brain tumor. Yeah. If you find a bruise on your body, do you think you bumped yourself, or do you even care, or do you think it's leukemia? When you have stomach pain, are you thinking of stomach cancer? 75% of patients, 75% of healthy people experience a new symptom every 3 days. Majority of us don't give those symptoms much thought. We take them for what they are, body noise. But approximately 15% of people will interpret these symptoms as a sign of serious disease. To them, waiting to see if these symptoms get better on their own is not an option. This disease must be diagnosed and treated with not a second to waste. And so they go to the doctor. The trouble is, doctors don't have an explanation for 3 out of 4 symptoms that patients experience. So odds are, in the 5 minutes you see your doctor, you're not going to be satisfied with what they have to tell you. The doctor doesn't have answers. Do you know who does? With the internet, if you ever Google the disease, you know 2 things. Every symptom is caused by a disease, and the disease is either cancer or a progressive neurological disorder that will disable you in a short period of time. So let's put this together. Jen has tingling in her hand and in other random parts of her body. Jen searches the internet and discovers that she is a textbook case of multiple sclerosis. Jen rushes to the doctor, who examines Jen, doesn't think she has MS, but can't really provide her with a satisfactory explanation for what is going on with her. Jen knows better. WebMD told her that the only way to rule out multiple sclerosis is to do an MRI. So Jen goes from doctor to doctor and finally finds a specialist who will order an MRI. Once Jen gets the MRI results, while she should be reassured, she fixates on the one line that says there is a slight abnormality, and she continues to worry. The economic costs of health anxiety are truly astronomical. They're greater. We spend more money on the pursuit of those symptoms than we spend on the treatment of heart disease and diabetes combined. But the economic costs of health anxiety are dwarfed by the personal costs of this condition. Patients like Jen report the level of disability and functional impairment similar to patients with major medical illness such as heart attacks or cancer. So, is Jen a hypochondriac? Or is this another case of limits in medical knowledge? After all, we still can't explain what causes most cases of back pain, and we don't call those patients hypochondriacs. What we know is this. There is no test that will explain what's wrong with Jen. There is no pill or procedure that will make her feel better. But there is an approach that's been shown to be highly effective at helping patients like Jen reduce the volume of their symptoms and the stress that the symptoms cause. It turns out that patients like Jen have a very specific way they think about their symptoms and act in response to their symptoms. And by addressing these thoughts and behaviors, we can help 3 out of 4 patients like Jen get better and stay better. So the first step is to identify patients like Jen. As you can imagine, all these tests, exams, and visits generate a lot of data. You can mine this data to predict which patients are unlikely to get further relief by continuing to pursue medical explanation. The next step is to give these patients a treatment that does work. And this is a well-studied, effective treatment that addresses the patient's tendency to have dysfunctional health-related thoughts and behaviors. And finally, we need to help patients like Jen after they graduate from the acute phases of the treatment to support them throughout their life so that they don't let their symptoms and their symptom stress stand in the way of living their life to the fullest. Muse was incubated by Canby about a year ago, and we help patients who suffer from ongoing symptoms and the stress the symptoms cause. We also help doctors treat these really difficult patients, and we can save about 20% of wasteful utilization by these patients. So if you have any of the skills above, we're in a year of big growth. Find me after the presentation.